Is my acne severe? That's a question that comes up a lot, and that's what we're going to talk about today. Welcome, I'm Dr. Arthur Kolsky, founder and medical director of Advanced Acne Institute, and we are a dermatology practice focusing solely on the treatment of acne. That's all we do. We specialize only in treating acne. So we have certain unique observations and experiences that we like to share with acne sufferers who are navigating the path toward clear skin. So we hope you find this information useful, but this is not medical advice. This is only for educational value. So the question, is my acne severe? So that's a question that comes up a lot. Patients want to know, what do I think of their acne? Is it severe enough to use this treatment or that treatment? Is it mild? Is it moderate? And this is a loaded question because the answer to that question depends on a lot of circumstances. For example, what is severe for one patient might not be severe for another patient, in the sense that one patient might have very minimal breakouts, but acne could be very debilitating. It can have very significant emotional consequences. They might not want to leave their house. They might want to not go to work. They might drop out of school, and these things actually happen. Whereas another patient might have very, very significant breakouts, very cystic breakouts, and lots of scarring and lots of inflammation, and they might not be bothered by that, and they're really not even interested in treating it. It doesn't bother them. So everybody is different in the way that they respond to having acne. So those factors can never be overlooked. So when a patient is asking, is my acne severe? Well, it depends. How much does it affect them? How much does it bother them, interfere with their daily routine, interfere with their quality of life? Are they developing scars? That elevates acne into a whole nother category, because when a patient is developing scars from their acne breakouts, scars can be permanent and they can be very difficult to manage, to address, to try to treat. So we always like to intervene more aggressively when we see a lot of scars forming. And that doesn't mean that someone has to have big cystic breakouts. They can have very small pimples and still develop scars. That's something that is determined individually by the person's individual genetic makeup, how they respond to that type of inflammation and whether they heal with scars or not. So it's not an easy thing to answer, and it depends on each individual circumstance. So there are no magical rating scales that we have that we use to define whether somebody has severe acne or moderate acne or mild acne. Although you'll find those in the medical literature, there are lots of those types of scales and those grading systems where a patient has this many pimples or that type of pimple, etc. They get assigned to certain grades of acne, but I don't personally like to use those because I think they underrepresent some of the hidden effects of acne that are not readily observable, such as the emotional consequences. And sometimes patients aren't really ready to share how acne makes them feel inside. But those factors do play a big role in determining the severity of acne and how it affects a given person's quality of life.